Lauren, and this is Jane, and today we're going to go over the vital signs and how you check them to see if your horse is healthy. Jane is in cross ties because she's not in distress, and I know that they won't bother her, but if you're taking vital signs of a horse that you believe to be sick or impaired in some way, you should probably have a handler for safety. When I check for the vital signs, I usually start at the front of the horse and work backwards. So first I'm going to check the gum color and the capillary refill time. So I'm going to lift up her lip and I'm going to look at the color of her gums and I'm going to see if they're moist or if they're tacky. The normal gum color, it should be light pink and moist. If they're tacky, it could mean dehydration. As far as color, like I said, light pink is the normal color. If they're white, it could mean shock or anemia. If they're yellow, it could mean jaundice. Fiery red could be infection, and brick red or a bluish color could also be lack of oxygen. So I'm going to lift up the lip like this, and I'm going to just look for the color, always keeping in mind that this is a horse's mouth and you need to watch where your fingers are. So I'm going to do this again, and I'm going to press in with my thumb for about 1 or 2 seconds. I'm going to pull away, and that white color should return to the light pink color in 1 to 2 seconds. If not, it could be a sign of dehydration or poor blood flow in the gums. So now moving down the horse from front to back, I'm going to do a skin pinch test, and this test for hydration of the horse. So I'm going to come to her neck right here in this triangular area. I'm going to take a big pinch of skin, I'm going to pull away and let go, and the skin should return to flat within 1 to 2 seconds. Jane is an older horse, so her skin may take longer, which is okay because an older horse will have the more flexible skin. So she doesn't look dehydrated because her skin returned back. So now I'm going to check the pulse. So the normal pulse for a horse is 32 to 44 beats per minute. There are 2 different places you can check this, and then there's another place about the pulse that I'll show you in a minute. So underneath the jaw right here is the external maxillary artery. So you're going to come up here to her, make sure that she knows you're here and is okay with you prodding around under her jaw, and you're going to feel around until you find the vein. She has a nice big one, so I found it already. And you're going to push down. You're going to have someone time you for 10 seconds, and then you will multiply the number of beats you feel by 6, and this is how you will come up with the pulse rate. So I'm going to feel, and I have Annabelle timing me. So I felt 7 beats, and 7 times 6 is 42. So Jane's pulse rate is within that of a normal horse, so she's good. Another place that you can check this is radially, which is right back here behind the knee. It can be harder to find the pressure point here, so you'll have to feel around. I found it over here. So I could do the same thing that I did there with the same timing method. Another place that you may be able to feel the pulse is down here. This is called the digital pulse. You'll kind of press your fingers. You can do it down lower underneath the pastern or up high underneath the fetlock, depending on what you prefer or what you may feel it best on a horse. You shouldn't feel this unless your horse has some type of foot issue or if there's pain in the foot. You wouldn't really count this one. It's more of if you feel it bounding, you know that there's a problem in the foot. So now I'm going to check her heart rate. This should be the same as the pulse, 32 to 44 beats per minute, but I'm going to check this one with a stethoscope because it can provide a lot more accurate reading than just listening with my ear and also be a lot safer. So I'm going to place these in my ears. Make sure she knows that I'm here because it can be a little cold and not good for her. So I'm going to place this, I'm going to have a hand on her, I'm going to place it right behind her elbow. I'm going to need to feel around a little bit to get a really good spot. And I'm going to have to push down. There's a really good beat there. So I'm going to have Annabelle count for me, or time for me, for another 10 seconds. And I'm going to count how many beats I feel. Okay. So I got 7 again. And 7 times 6 is 42. So again, it's the same as the pulse, which is very good, and it's within the normal range. So that looks really good. So now I'm going to check for gut sounds. And I'll move back here. This one you really need to be careful. because again, you're at the horse's flank area, which is really unpleasant for some horses. So just make sure you're watching what her ears are telling you, and also if she's lifting a leg or doing anything that could be dangerous. You can listen to this with your ear, but I find it a lot easier and safer to listen with the stethoscope, like for the heart rate. So the things that you're going to check, you're going to listen up here and down here on both sides, because there are 4 quadrants of the gut. So I'm going to clean off an area. She has a few shavings on her. So what I'm listening for is a constant rumble or near constant. I don't want to hear a gushing sound because that's hypermodal and that's not good, and I don't want to hear no sounds because that could mean a type of colic or a backup in there. So I don't want to hear that. I'm going to put these back in my ears. Let her know I'm here so she's okay with it. Keep a hand on her at all times and watch what her ears are doing. So I'm going to listen up high in the first quadrant. And I already hear a lot of gut sounds. Kind of a low constant rumbling with some gurgles here and there, so that's really good. Now I'm going to move down and listen in this quadrant. And I hear a lot there, so that's really good too. And again, I would move around her safely, and then I would listen on the other side as well. So those are the gut sounds. The final vital sign that I'm going to take is her temperature, and this is taken rectally with either a mercury or a digital thermometer. I'm going to use the digital, but I'm going to show you how the mercury works in case you need to use it ever. The mercury will typically be more accurate and run higher than the digital. So before you use this, it's important to shake it down. So you're going to want to do it really hard, just kind of shake it down like that, and you'll want to put petroleum jelly or some type of lubricant on it before you stick it. And you'll put that on with your fingers and then wipe your fingers off so you don't stick it directly in the jar and contaminate it so that another horse will get the same germs that your horse has. So, assuming that I've done that and I've taken this, there's a little silver line that you'll see in this thermometer. It can take a lot of practice to see it, but that is how you will take the temperature with this. And with this one, you want to keep a hand on it, and you also want to clip it to the tail with this, because if the horse moves, it could kick out and break, and it could also be sucked in, which would be very bad. And this one you'll also leave in for 2 minutes before checking. So I'm going to set this down. And then I have my digital here that's pre-lubed, so I'm going to take it back here. So I'm going to be back here. This is another dangerous area, so I want to stay off to the side and not directly behind her. And I want to keep my hand on her at all times and be watching her ears and other body language signs so that I know that she's okay with me being back here and isn't going to kick out or spook. So I'm going to take her tail, I'm going to lift it out of the way, like this. I'm going to go ahead and stick this into her rectum and push the button to turn it on. And it will beep when it's finished. So it's beeping, so I'm going to take it out. 98.4. That's really good. If you had a mercury thermometer, it might be a little higher because the typical temperature for a horse is 99.5 to 101.5 degrees Fahrenheit, and that's the normal. So anything slightly below would be good. Anything a little higher would be problematic, and you would want to get help for your horse. So those are the vital signs. It's a really good idea if you get a new horse or a new keeper horse to take all of their vital signs when you first get them so that you know what's normal for your horse.